In the first place, because we are for single-payer health insurance, for Medicare for all. And this is a positive thing that we stand for. And the reason we stand for it is because single-payer does something that no other health reform proposal can do. It brings everybody into the system on an equal basis. It cuts the costs. It gives everybody choice of their doctors and other providers in their hospitals, not their plans. My plan doesn't give me a choice of all the doctors I might want. Give you a choice of your doctors, your providers, and it spends the money on delivering actual health care, not on wasteful bureaucracy and big corporate profits. So that's why we're for single payer. What do we want?
Single payer!
When do we want it?
Now!
And then the other reason we're here today is because we want to send a message to Senator Ron Wyden and to the big insurance industry. You know, part of what's been going on with this healthcare debate, as has been going on in public policy, is that the single-payer position, despite it being the most rational, the one that can solve all the problems the best, has been shut out of it. It's an immediate blackout, and it's been shut out of the political debate in Congress. And why is that? It's because the debate is corrupted by big corporate money. So we're here to demonstrate in favor of single-payer and to protest the corruption of the political process that's excluding the best solution here. And the first speaker we have, I want to introduce, is Dana Welty. Dana is an activist with Jobs with Justice Healthcare Committee. She's one of our co-chairs, and she's also a critical care neonatal nurse up at OHSU, and she's going to talk to you about what this looks like from a nurse's perspective.
Nurses believe that health care is a human right. And that this country, with all of its resources and all the good people thinking about health care reform, can make this right a reality. Currently, 50 million of us don't have insurance, and at least that many more don't have insurance that they can actually use. It's very expensive. It's not enough. These numbers for nurses represent sick and suffering human beings with names and faces, spouses and children and families. Then there are the 18,000 people who die every year because they don't have insurance. That's a number, but what I know about that, those people come to where I work, they're sick and suffering right in front of my face, and they die in front of me, sometimes in my arms. So this is personal for me. This is personal. And I can't make things better for myself or my patients if the healthcare system I'm working in doesn't change to ensure healthcare for all of us. That a few individuals are making huge profits while so many are suffering and dying is unnecessary and a deep injustice, and it makes me angry.
That's right.
Everyone knows the system is broken, and there are so many solutions being talked about. It's mind-boggling to understand them. But single payer is simple. Basically, the money for health care, essentially collected through taxes, is collected by the government, and then you, every one of you, is enrolled in the system, and you choose the health care provider that you see. The private provider that you see is then paid by the government. In other words, it's like Medicare, but for everyone. What I want you to know is that the American Nurses Association and right here at home, the Oregon Nurses Association, support creating a single-payer healthcare system where everyone receives care and costs are controlled through this radically simplified administration, and because profits are taken out of the picture. You'll hear from legislators that Americans with private insurance want to keep it. I don't believe that's true, and polls show that 65% of Americans are ready to support a universal health care system in which everyone's covered under a program like Medicare that's run by the government and financed by taxpayers. That's actually the question that was asked, and 65% of Americans support that. Doctors and nurses support it, as you'll hear again and again. Who stands in our way? Private insurance companies, also pharmaceutical companies, and some large hospitals are making huge profits in the current system. And they pour millions of dollars into lobbying our congressmen and our congresswomen to maintain the status quo and to get them reelected. So they're dictating how the money's spent, who gets insurance and therefore access to health care, who gets medications, who can afford them, and then who gets reelected. They pay thousands of lobbyists in D.C. to talk to our legislators about the kind of health care reform they want, which ensures their profits, while millions are suffering. The power they hold over politicians and over people's lives must be taken from them.
Right.
All right. We're here at Wyden's office today to do just that. Wyden has a plan. His plan would require all individuals to purchase private insurance. So it's not surprising. It's not surprising that private insurance loves his plans. And if you're lucky enough to have health care benefits through your employer, he would tax those benefits as income. So there's this loop here, right? Insurance companies especially, but other companies as well, give Wyden money for his campaigns, and then his health care plan promises insurance companies more patients so they can make more money and then donate more to his re-election campaigns, and on it goes. So where are we in this loop?
We kick him out.
We kick him out. We're outside the loop. We're drowning in paperwork. The doctors can talk about that. We're drowning in paperwork. We're trying to help people who come into the system too sick, too late, or we're the people out there suffering and dying without access to the health care we need. So basically, Wyden's Healthy Americas Act won't make for healthy Americans. The real solution that keeps costs controlled and guarantees health care to everyone is out there, and it's called
Single payer.
And we're going to have to fight for it. We're going to have to tell legislators again and again that they're supposed to be working for us,
Right.
and we want them to fight for us on our behalf for the kind of health care reform that we know will work.
Right.
So they're not listening, and that means we're going to have to get a little bit louder.